father sits at his kitchen table late at night holding a piece of paper that makes no sense. His young daughter tripped over a toy and sprained her ankle, leading to a brief 30-minute visit to the local emergency room. A nurse checked her pulse, a doctor felt the swollen foot, and they wrapped it in a basic elastic bandage before sending her home. Now, the official hospital statement demands over $4,000 for emergency medical care. The paper shows a single line item that costs more than a good used car. The bill lists a charge for high-severity emergency service, claiming the child needed immediate life-saving care. There were no blood tests, no x-rays, and no heart monitors used during the brief visit. Yet on paper, this simple ankle strain was processed as if the patient had arrived in a rescue helicopter with a major life-threatening injury. This outrageous charge is not a rare clerical mistake or a simple typo by a tired clerk. It is the result of a widespread practice called upcoding, which means billing for higher-level medical care than was actually provided. Hospitals across the country use this financial trick every day to turn quick routine visits into huge corporate payouts. By changing a single code digit, a hospital can double or triple what it charges. To understand how this money machine works, you have to look at evaluation and management codes, often called EM codes. These 5-digit numbers tell insurance companies how much time and effort a doctor spent on a patient. A Level 1 code is used for simple problems like a small cut or a routine check. A Level 5 code is reserved for life-threatening emergencies like severe chest pain or major bodily trauma. When a doctor opens a computer screen in the exam room, software called an EHR or electronic health record guides every single step of the visit. These medical programs use standardized electronic health record templates filled with mandatory checkboxes and drop-down menus. The computer prompts the doctor to click through long lists of body systems and past medical history questions, even when those questions have nothing to do with the patient's condition. Every extra box the doctor checks feeds data directly into a hidden revenue program built inside the computer software. The system measures how many boxes were clicked and automatically calculates the perceived medical complexity of the visit. The doctor might spend 3 minutes talking to the patient, but if 10 boxes are checked, the computer automatically labels the visit as a high-intensity Level 5 emergency encounter. Large medical software companies design these billing tools to help hospital networks maximize their daily revenue. Corporate boardrooms sell these software setups with promises of finding lost dollars in every patient encounter. The software acts like a silent nudging tool, urging healthcare workers to add more documentation so the final bill can be pushed into the highest possible payment tier without triggering immediate red flags or claim denials. This forensic breakdown of EHR-driven upcoding in emergency settings shows how modern billing turns basic patient care into a digital profit game. A minor cut that takes 5 minutes to clean and dress becomes a complex surgical evaluation inside the hospital computer database. The hospital does not provide more staff or better care, but the final bill jumps from $300 to $3,000 with a single click. Government watchdogs have caught on to this widespread pattern through deep financial investigations. Official OIG audits conducted by the Office of Inspector General analyzed millions of emergency room claims over several years. Their official reports discovered a massive shift in how hospitals bill for emergency services, showing that high-level charges skyrocketed while low-level charges almost completely disappeared from billing databases across the entire country. The findings from these OIG audits revealed that hospitals billed for top-level emergency care even when patient records showed no complex medical care was given. Over an 18-year period, the percentage of emergency visits billed at level 4 and level 5 rose by over 70% nationwide. This systematic change added billions of dollars in extra costs to the national healthcare system every single year. Inside the claims departments of major insurance firms, automated computer programs process millions of these inflated bills every day. These digital systems rely on automated denial tools and claim rules that often pass the higher code charges directly down to the patient. If the hospital documentation contains enough checked boxes, the computer approves the inflated code without any human worker reviewing the actual medical record. Insurance companies often agree to pay a set percentage of these inflated code amounts because their contracts with hospital networks allow it. However, the patient is left paying the rest through higher deductibles, co-insurance, and rising monthly insurance premiums. The system creates a continuous loop where the hospital charges more, the insurer passes the cost along, and the patient pays the price for artificial complexity. For families sitting in living rooms across the country, these surprise medical bills trigger severe financial panic and deep emotional distress. A simple trip to the local emergency department for a basic injury can suddenly drain a family savings account or max out personal credit cards. Working parents are forced to choose between paying for household groceries, electricity bills, or settling an inflated charge created by an automated computer code. When patients cannot afford these $5,000 bills, hospitals quickly hand the accounts over to aggressive debt collection agencies. Unpaid medical debt stains personal credit histories and drops credit scores, making it harder for people to buy a car, secure a home loan, or rent an apartment. The quiet tick of a computer box inside a hospital room ends up harming a family's financial future for many years to come. Behind the polished glass of hospital executive suites, corporate managers defend these billing practices as a necessary way to pay for operational overhead. Modern hospitals face immense administrative bloat, employing large teams of medical coders, billing specialists, and corporate lawyers whose main job is to squeeze every dollar from insurance contracts. Upcoding becomes a standard business strategy used by management to keep hospital profit margins consistently high. As hospital systems purchase smaller clinics and expand their regional networks, they standardize these aggressive coding techniques across every department. Routine doctor office visits that used to cost $50 are moved into hospital-owned outpatient settings where extra facility fees and inflated EM codes can be charged together. The continuous drive for higher corporate profits turns every routine doctor visit into a major medical event on paper. Patients do not have to accept these inflated bills without putting up a strong fight. The first step in exposing medical billing abuse is demanding a full itemized bill with standard coding numbers clearly listed. Every patient has a clear legal right to see every specific charge billed for their care, including the exact 5-digit CPT code used for the doctor's time and clinical evaluation during the visit. When reviewing an itemized bill, patients should compare the code listed on the statement against standard medical code descriptions like CPT and ICD-10 sets. If the bill lists a Level 5 emergency code, but the doctor only provided 10 minutes of basic care, the patient has strong evidence of upcoding. Comparing the written medical notes with the final bill exposes the gap between what happened and what was billed. Armed with this documented evidence, patients can file a formal written dispute with the hospital billing department and their insurance provider, mentioning that the bill appears to contain an inaccurate EM code level, often forces the billing office to perform a manual review. Pointing out these potential coding discrepancies can cause the hospital to lower the total bill back to an appropriate and reasonable care level. Lawmakers and healthcare policy advocates are beginning to push for stricter rules to stop software-driven upcoding in emergency care settings across the nation. Proposed legislation aims to limit how hospital computer systems generate automated coding recommendations and demand greater transparency in how facility fees are added. Closing these legislative loopholes is essential to preventing healthcare corporations from abusing computer templates for easy financial gain and unearned profit. The unchecked rise of artificial upcoding damages the public's trust in the entire healthcare system. When working families fear that entering a hospital emergency room will result in unfair financial charges, they may delay seeking vital medical treatment during real health emergencies. This corporate practice of turning routine human suffering into inflated financial codes threatens both public health and long-term economic stability on a massive national scale. Exposing the hidden mechanics of hospital coding empowers every patient to question their medical bills and demand fair treatment. By opening those intimidating envelopes, inspecting the code numbers, and challenging unfair charges, ordinary people can fight back against predatory medical billing. Knowledge remains the most effective weapon against the silent computer algorithms that turn simple medical visits into outrageous financial demands for everyday families.